and I'm the Executive Director of NorCal Mental Health America. And we are in opposition to 1194. And I really want to remind everybody that the civil rights movement for mental health clients in America has been a very long-fought battle. For many years, as you well know, people were forced into institutions, shackled, and treated very abusively. And in our opinion, this type of legislation harkens back to a time like that, because we are really considering forcing people to take medications when they have committed no crime. There is really no other disability where we force someone to take medication or force them into treatment when they haven't done anything to violate the law. So it's really a civil rights issue, and it will always be a civil rights issue. Mental health clients' civil rights have been violated for way too long. And this bill threatens to do the same thing, because it's a very slippery slope. It's based on predictive behavior. The risk does not have to be imminent. It allows no opportunity for the possibility that somebody could recover. I mean, we look at the past behavior and we say they're going to do the same thing in the future. But that's really not based in any kind of factuality. It's not based in evidence, and it's not based in any kind of criminal activity. So it really is, and it can also be based on people's opinion. People in my life could say that I need this kind of treatment, and I could potentially get it under this bill without real evidence. It could be anecdotal. And I understand the need to look at somebody's history, but we're not talking about their medical history. We're talking about their behavioral history, which is often very subjective and open to interpretation. In California, we live in the era of Prop 63, the Mental Health Services Act, which represents a new era and a paradigm shift in the way that we view mental health conditions and how we deliver services. It represents an era of recovery, resiliency, giving people a voice and choice in their services, which we've never had before when people experience these kind of mental health conditions. Everything we do now must be viewed through this lens of potential recovery and resiliency, which does not automatically assume that we don't know what's good for us. In this era, we do not deny people their civil rights based on predictive behavior and a fatalistic view regarding a person's ability to recover. Thank you.
Somebody turn it on for me. This is Margaret Johnson with Disability Rights California. We're opposed to this bill. Present risk of harm as defined in this bill is overbroad. Most anything could be considered dangerous, and thus involuntary detention could occur for anyone with a history of a mental health disability. Under current law, present danger is based on all the circumstances, including historical course. The proposed definition suggests that historical course alone can lead to a finding of a present danger. Singling out historical course puts too much emphasis on it, and it opens the door to the possibility that someone will be involuntarily confined for mental health disability alone. Determination of dangerousness requires consideration of the type of risk and type of potential harm in order to justify confining a person in a mental health treatment facility against their will. So for those reasons, we oppose it, and we urge your no vote.
Thank you. Additional witnesses in opposition?
Lucinda De Rossi, representing the California Association of Social Rehabilitation Agencies, and we strongly oppose.
Sally Zinman, represented the California Association of Mental Health Peer-Run Organizations, which is an organization of consumer-run programs and organizations which themselves serve thousands and thousands of clients. We firmly opposed and fear that this looks backwards 40 years when people could be committed based on prediction.
Megan Wheelahan, Patients' Rights Advocate from the Mental Health Advocacy Project of the Law Foundation of Silicon Valley, in opposition.
Matt Gallagher, a Youth Advocate for Mental Health America of Northern California, also in opposition.
Questions or comments from committee members? Councilmember Rodriguez.
Yes, I want to thank the author for not only this bill, but the bill before regarding the mental health issues. I can speak from a lot of my experiences being out there in the front lines when we do receive some of those calls for service, especially in the emergency situations where we need to take into consideration all the history of those patients, because I was reading one of the articles here on one examples of when we do show up on folks' houses where they can maintain a sense of calmness for about 20 minutes, and then as we leave, we'll return back in an hour or two, and now something really severe has happened, and now we may have more than just one patient and two. So I want to thank the author for bringing both these bills forward. I appreciate your help and concern in addressing this very important issue, and I will also be a strong yes vote on your bill. Thank you.
Additional comments or questions from members?
Yes.
Yes, Assemblymember Lackey.
Yes, Ms. Eggman, I really do appreciate your intervention here. I just wanted to really briefly mention that my experiences have been very, very powerful. And I have to say that dangerous behavior is not always criminal behavior. The large number of people that had mental illness that I encountered throughout my 28-year career is very substantial. And unfortunately, because of our system being the way it is, we weren't able to get a number of those people the proper intervention. And unfortunately, it led to very tragic circumstances where suicidal circumstances were the end result. So I think that this type of intervention is critical to those who rely on us to help them. And I see that this as a very, very meaningful pathway, and I'm proud to support it.
Additional questions or comments from members? Assemblymember Eggman, if you would you mind just briefly addressing some of the concerns raised by the opposition with respect to the historical course of a person's mental health disorder potentially being misused here?
Certainly. This bill specifically states that somebody cannot be committed because only of historical considerations, but that must be taken into consideration. So it is, and I certainly hear the opposition talk about how things used to be, and as we all know, pendulums swing in full circle. So I think we went from a very dark time in our history to now when sometimes people can't get the help that they need, and we'd like to find an easy balance somewhere in the middle. And I'm sure we all have stories of family members or people who needed help. I grew up with a very close friend who parents tried forever to get her into the hospital. And I, as a social worker, they would come to me, what can we do? But if she wasn't in imminent danger at that time, they couldn't take it into consideration despite escalating behavior. And I talked to her the day that she died when she said, I need to get a haircut. And they found her the next day with a bullet hole in her forehead. That was her idea of a haircut in that moment. And her parents, lived with that forever, the years that they tried to get her help and the so many times that she was turned away. And I think, we need to broaden this discussion. We need more help. We need more resources. Prop 63 has been wonderful. There's a lot of good evidence-based programs out there, but we need to continue to expand them and also to expand the bed space. When people do need to be able to be in the hospital, we need to have the available bed space for them to be able to be safe and to get back on track. So I respectfully ask for your aye vote on this, I think, a very important measure.
Thank you. That's very helpful. Can we accept that as your close?
Yes.
Okay. The committee can entertain a motion? We have a motion and a second. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gonzalez? Gonzalez, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Ridley Thomas? Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Steinnorth? Thurmond? Waldron? Waldron, aye. Wood? Wood, aye. Ridley Thomas, aye. 11-0.
Bill passes 11-0. Congratulations.
Thank you.
Thank you very much, Mr. Chairman. Next up is item number 6, AB 366. Mr. Chair, you may proceed when you're ready.
Yes. Thank you, Mr. Chair and members. AB 366 provides an increase to Medi-Cal provider reimbursement rates to increase access for Californians in the Medi-Cal program. We have about Thank you. This is a critical bill. We have half of California's children in Medi-Cal, nearly a third of Californians in Medi-Cal. We need to make sure that they have access to the care that they need when they need it. And we can't have a second-tier system for our poorest Californians. I respectfully ask for your aye vote. I have two witnesses with me today. I have Dr. Luther Cobb, President of the California Medical Association, and Lex Smith from the California Hospital Association.
Thank you, Mr. Chair. Am I on? Yeah, thank you. I'll try to be brief because I have to drive 300 miles to get home myself here. My name's Luther Cobb. I'm a board-certified general surgeon in Humboldt County, president of the California Medical Association, and I'm here to testify in favor of 366. For almost 20 years, my wife, who's also a board-certified general surgeon, and I've served this community. We're both Stanford medical school graduates, residents, did our residency there, I was on the faculty, both of us, for over 10 years, and then we decided to move to an underserved area. By being there, we know how difficult it is for Medi-Cal patients to receive services in a timely manner. The abysmally low rates make it almost impossible financially to keep in practice if you're taking care of a significant number. Since this committee's hearing March 4th on this subject, there's been several new developments. According to a CDC study, California was the second lowest rate of physicians accepting new Medicaid patients, only 54% accepting them in 2013. They also found it was lower in states with lower rates, which is obviously no surprise. Another study this month from Health Affairs found that visits to California emergency departments for medical conditions increased, while visits for injuries were down. Traditionally, we think of ERs as accident rooms, but they're now treating chronic medical conditions because they can't get timely access to primary and specialty physicians. They had Medicaid patients, Medi-Cal patients in this state had the highest rate of non-injury ER visits. Finally, media publications across our state continue finding patients experiencing serious, life-threatening hardship accessing care under Medi-Cal. From the California Health Report, there was a woman in L.A. who had a Medi-Cal reimbursement who died from cancer after several unsuccessful attempts to access desperately needed care. She couldn't get in. Despite the assurances that you hear from the Department of Health Care Services, we all know these tragedies happen far too often across our state, and this has to be addressed, and it needs to be addressed now. This bill would make dramatic improvements in the system, raising the recently cut rates and bring it up to Medicare rates, which is a very successful program. I speak for the 40,000 members of the CMA and would like to commend you for bringing this up and thank you for your help. I cede the rest of my time.
Thank you. I'm Lex Smith, the CEO at Mead Memorial Hospital in King City, California, and I'm representing the California Hospital Association in regards to AB 366. Just to give you a little bit of the characteristics of our hospital, it's a very rural hospital. We serve 40,000 residents in Monterey County. We're the only hospital for a 45-mile radius. North of us, 60 miles east, and on the west, you have to go to Tokyo, Japan. So we serve a very rural area. Additionally, I will tell you that the hospital has insurance coverage of 60% of our patients covered by Medi-Cal, 20% by Medicare, 15% commercial insurance, and 5% are slow pay, no pay, or self-pay. Additionally, the hospital has filed for a hardship exemption under the request of the clawback, which is in place, and that's what I'm here to talk to you about, because we have a distinct part nursing facility that's 59 beds out of our 119-bed hospital, and the liability that our hospital has on its books due to the clawback for our distinct part nursing facility is $2,185,539 for a rural hospital. We are the largest employer in the community. We have over 450 employees. We have over 94 physicians, and we are the only facility providing emergency department, an OB department, dialysis center, skilled nursing facility. And one of the most important things is 85% of our patients that are in our distinct part skilled nursing facility are covered by Medi-Cal. The clawback that's in this bill in terms of the AB 97, where the AB 366 will remove that clawback from the hospital, is $2.1 million. Our balance sheet that the hospital is showing at the end of 2014 was a deficit of $2.1 million. So the reason that the hospital is in a deficit is due to the clawback. The impact on our hospital that this causes is that we have bank debt that has to be refinanced in 2015, and that bank debt and long-term debt is $23 million. We've gone to the various financial institutions, and they've said that there's no way that the hospital will be able to refinance that debt. The hospital also is incurring higher interest because of that. We also have a 1962 hospital that has to be, I call it, renovated and torn down due to seismic requirements here in California. So the hospital is not able to do the various construction projects. So I want to thank you for your consideration of this bill. I want to thank Assemblymember Bonta for sponsoring this bill. It's very important not only to Meade Memorial Hospital, but all those rural hospitals in California that are providing distinct part skilled nursing facilities for their patients and their residents. Thank you.
Thank you. Further witnesses in support, name and organization, please.
State Sawite Siyum with Health Access California. We're the statewide consumer advocacy coalition on healthcare, and we're in support.
Mr. Chair and members, Gary Passmore with the Congress of California Seniors. Just to note that many long-term care providers that provide services to older Californians are almost exclusively Medi-Cal in financing, and they're going broke, and this bill needs to be passed. Thanks.
Mr. Chair and members of the committee, Johan Claes representing Paramedics Plus from Alameda County, the 911 EMS ambulance provider. 33% of their transports are Medicare, 33% are Medi-Cal. They receive $103 reimbursement on a $600 ride. It's a problem that has to be solved. We support the bill.
Hold on a second, Mr. Nowar. Just a quick reminder, name, organization only, please, because we've filled the time, the committee's time with the witnesses up here. You may proceed, Mr. Nowar.
Thank you, Mr. Chair, members. My name is Fred Nowar. I represent the Association of Northern California Oncologists and the Medical Oncology Association of Southern California, urging an aye vote. Thank you.